Dr. Marion Mass, welcome to the show.
I am so delighted to be here. Thank you for having me.
I love the robe. Reminds me of the old Rubber Ducky song. You know, Rubber Ducky, you're the one. Oh, God, I'm dating
I love
myself.
Ernie and Bert. I love
Yeah.
Ernie and Bert. But it reminds me not to be a quack. And truthfully, I just kind of got tired out of changing out of my pajamas on days when, like last night, I worked till past midnight, drove home, and I'm comfy. I can get stuff done when I'm comfy. I've been doing this for far longer than the pandemic.
Yeah, well, this is great. I mean, this is a first too. I haven't had anyone do a bathrobe, but it's a ducky bathrobe, which is great. We had a prior discussion about what to talk about, and a couple of days ago, I saw a video that it was a young man who was showing charts of the US system versus the rest of the world. And he made a point of showing, look how much we spend as a percent of GDP. And he said, we actually spend about the same as everyone else, publicly. And then he showed the private side of healthcare. And he was sort of making the point that, you know, hey, for all you free marketers, we're spending a lot more on private healthcare, and I'm thinking to myself, young man, I don't think you're old enough to know that we haven't had a free market healthcare system in a long, long time. And that was my reason for bringing this up. How far do you have to go back to really understand? Because if you don't go back, you're going to be ignorant like he is, because he doesn't get it. And there are a bunch of things he doesn't understand, right? But how far back do you have to go, and what are these really important points?
Well, I say, let's do this. Let's dial really, really, really far back to the time of the Oath of Hippocrates. It's sitting like right behind me on my wall. And I keep it there and just kind of remind myself. And I think I'm not going to go through what the Oath of Hippocrates says, but I think anyone should take a look and look it up, because really since the dawn of medicine, the dyad has been the patient and the physician. You know, there's other important essential members of the healthcare team now, and I'm not meaning to diminish their roles at all. But if you want to break it down to the very essential dyad, it's the patient and the physician. And it's based on that oath back there. So when something has been talked about and it is in the lingo and is known by people for millennia, like two of them, more than two of them, then pay attention to it. So what I would encourage people to do is read the oath, the Hippocratic Oath, because as a physician, that is something that bonds me to every other physician out there. And I'm not going to say this, well, I am going to say this. I'm going to say this in a very serious way. We all have to think, whoever we are, whether we are from Alabama, Alaska, Massachusetts, Pennsylvania, like me, whether we live in the suburbs like I do, whether we live in far out rural Montana, whether we live in inner city Philadelphia, you know, like my father grew up in, whether we are right leaning, left leaning, straight down the center, swing back and forth, all of that, as physicians, that bonds us, it binds us. And I think it gives us a little bit of a higher calling. And sadly, there are members of my profession that I do not think adhere to it, and that have sold out. They're kind of like scrubs gone wrong, right? But so then I want to fast forward and pick up in American healthcare. It's really hard to go through everything, but I'm going to try to take you through like lightning rods of time as I see it, flashpoints. So let's go back to the 1920s, you know, when we were just getting ramped up after the 1918 flu pandemic. And we were discovering that hospitals became so essential and necessary because of the pandemic and other things, you know, and we were urbanifying, for lack of a better word. Most of the hospitals came to be in urban centers, right? And then, we started developing networks for hospital supplies. And, over time, hospitals back then, actually, hospitals back then were very charitable organizations, often run by religious organizations, like the Catholic health system, right? You think about all of the Catholic hospitals in the United States. Hospitals were charitable organizations. Remember that. The history of hospitals were charitable organizations. So let's fast forward to another flashpoint, and it's after or around World War II. At some point, it became, I believe it was in the 40s, that was the inception of Blue Cross Blue Shield. They were the original health insurance company, right? So this is right around the time of hopefully the war to end all wars that came after the war to end all wars. So at the time, now we're a little bit more urbanified, if that's a word. I just made it if it's not. And we were at a time in America where we were moving to rapid industrialization. So I like to say, when you're thinking of this, I want you to think of the parallel worlds that was going on in American nutrition, American healthcare and American nutrition. There's big ties, right? If you think about at that time, people were not eating processed food with white sugar, white flour. Mom was doing cooking, or dad was doing cooking. Someone was doing cooking. It was usually mom, but most people paid for healthcare out of their pocket, and it wasn't outrageously expensive. In the 1940s, we had Blue Cross Blue Shield develop, and around this time, we had health benefits became tied to wages. You couldn't increase wages by terribly much, but you could allow health insurance to become part of the package, and therefore you could attract more workers if you offered healthcare benefits. And it all sounded great, right? Because people were worried. Now we've gone like 20 years past the hospitals really forming, to the point where everyone's worried, because what if I had a very expensive hospitalization? Oh, someone else will take care of it. Someone else will take care of it is always a bad idea when it has to do with your money. My husband is fond of saying, like, I know you don't like finances, but your own money is really, really interesting. Finances may be boring, but your own money, very interesting. And we lost that lesson, right? So before the 1940s, people paid their doctor. They knew what they paid their doctor. Sometimes they paid in vegetables. Sometimes they paid just cash, hen's eggs, barter. Absolutely. I'm not suggesting we go back to that. We're not going to. But around the same time, wages and insurance became tied together. Insurance started forming back there, Blue Cross Blue Shield, and they're one of the most powerful ones. If you look at the top organizations for lobbying over the last 20 years, as a single standalone insurance company, they're up there. It's because they're old and, well, they're not venerable, but they're old and they've been at it for a long time. Maybe back then even, it wasn't a bad thing. Then let's fast forward some more, and I'm going to take you through a lot of years. And then we get to the 60s. Let's take us to the 60s. In the 1960s, we got Medicare and we got Medicaid. And I'm not suggesting we should get rid of Medicare and Medicaid. But when we got Medicare and Medicaid, it gave a large portion of the population the ability that everything was just covered, right? Covered. I don't like the word coverage, because coverage is not care. And when you cover something, you're also you're giving people a perverse incentive to cover up the cost and make money from it. And that is exactly what has happened, isn't it?
Oh boy, yeah.
So, at the time in the 60s, seniors were worried because they had worked and they had saved and they had scrimped. And then they realized that as medicine had advanced and we had wonderful, innovative things, which is a great part of American healthcare. Our innovation is phenomenal. Look what just happened. We had warp speed, and we put together, the pharmaceutical companies that everyone, complains about, and me too, because there's some accountability that needs to be had there. Those pharmaceutical companies laid down their arms and worked together. They shared data. I mean, think about the fact that Merck and Johnson, Merck didn't get a vaccine, but they're partnering with Johnson & Johnson to be able to manufacture more. Whoa! That's absolutely shocking. Americans should be happily shocked. So anyway, so innovation is a positive. However, everyone is concerned because innovation is costly. So now we have coverage via Medicare and Medicaid, but look what else coverage does. It gives the government the perverse incentive to control. I do think there needs to be oversight on Medicare and Medicaid, but did we really get good oversight? Because really what we have is we have a government who is, I mean, there's a secret relative update committee that's led by the American Medical Association, the AMA, that functionally gets together behind closed doors and sets the prices for some of what Medicare pays for. And those Medicare prices that the RUC committee sets up, that's really the basis for what most of the people call them the private insurers pay for various things in medicine, right? So behind closed doors, we have the government and physicians that are part of a legacy group rate setting, and then the insurance company working off of that rate setting. And so now you have like perverse incentives, right? Because what you've stuffed things behind that closed door, and you're price fixing. You're not having competition. Now let's fast forward a little bit more. So time goes on, and my father-in-law was a physician, a rheumatologist, and an internist, and a darn good one. And he was from what he calls the golden age of medicine. And he tells stories from the 1970s, how physicians just took Mrs. B and Mrs. D and Mr. X, and they said, look, your sugars are a little off. We're going to throw you in the hospital, but don't worry, Medicare is going to cover it. And I'll come and I'll visit you. And these doctors would throw the patients in the hospital. They'd stop by and say, oh, Mrs. B, how's the nurse treating you? Mr. X, how's it going, my friend? Great, I'm so glad you're well. And then they'd like cha-ching, cha-ching. They just bill. They would stop and they would visit maybe 20, 30 patients in the morning, and they would bill and the government would pay them. It wasn't the golden age of medicine. Maybe it was the golden fleecing of medicine. Yeah. I love mythology, the golden fleece. So in any case, oh, actually, I want to show you something. Hold on. Frankly, I'm going to say that the old guard in medicine that were scrubs gone wrong potentially made monkeys out of all of us young physicians now. Because what happened when we overspent, you may have had like some, kindly, moral people that were following that oath. Remember that oath? But you had people that were fleecing America. And then, like, once you've collected too much, then someone has to come along and put the brakes on it. So then in the 70s, we got the, during the Nixon years, the HMO Act. So now we got maintenance organizations. So they were going to put the brakes on everything, right? And then, the medical establishment got a little nervous. I think they did. I think this is the response to that. And then in the 1980s, we got, if you do a close-up, we got the ACGME formed in 1981. I know this is kind of like a not so little, it's a scratchy graphic, right? But I kind of traced it out one day because it looks to me like all of the old legacy people, like the AMA, who are setting the rates, got together with the American Hospital Association, remember? And all of these hospitals, of course, because they were getting paid by Medicare and Medicaid as well, they got wealthier. But all these organizations got together and they sort of formed a super group called the ACGME. And there's good things about the ACGME, the medical education portion, and there's good people in them, and there's good people in every sector of these things that we're talking about. But so we get, to the 80s, and then there's like a lot of push-pull. And, the physician groups plus the hospital groups, now referred to as providers, right? And like a little bit of infighting. And then in the late 80s, along comes the Medicare Medicaid Patient Protection Act, which was probably maybe a pushback on the power of some of this here. But buried in the Medicare and Medicaid Patient Protection Act was an anti-kickback exception statute for the healthcare supply chain in hospitals, right? So, because over time, hospitals got even more complicated because there's more people having more procedures and there's more devices and there's more drugs and all kinds of stuff. And everyone's getting richer, richer, richer. And then in 87, in the Medicare and Medicaid Patient Protection Act, they allow legalized kickbacks for the groups that are now incentivized to become bigger and solidify, condense, and control the hospital and nursing home supply chains, which they did, because now there's like 4 companies controlling 90% of that. Companies that can receive kickbacks from the manufacturers and decide what products go into the hospitals. And they're, not even moving things around. I mean, this is absurd, right? And then that wasn't good enough. I mean, Reagan signed that, but then in 2003, we get the Part D of Medicare, right? Which is like, I don't know, Part D of Medicare is pretty much a slush fund for everybody, isn't it? I mean, pharma, all of those middlemen that are tied to the pharmaceutical companies, but Part D of Medicare, you should go back and look at the history. It's interesting because it was the Senate Majority Leader at the time that really pushed for it. It was Bush's HHS secretary, the second Bush in 2003. His HHS secretary, Tommy Thompson, ran Amtrak, governor of Wisconsin, and then he runs HHS because when you're the head of Amtrak, you must know a lot about healthcare. So anyways, so there he is. And the same year that Medicare Part D passed, and by the way, there was only like 20 Republicans that voted against it. Amazing.
This is a bipartisan screw up. So
it is a total bipartisan screw up.
Yes. Over the entire history, it's not one party or another.
Oh, they're all screwing up.
Oh, yes.
Yeah. Because like I said to a chief of staff one time, I said to a chief of staff one time when he was telling me, like, look, we can't do this because it'll make it look bad. And I just looked at him and I'm like, dude, you are bad. You're all bad. Or most of you, or a lot of you, or some of you. I don't even know what to say anymore. Maybe we should edit that part out. Maybe not. I don't know. Anyway, 2003, we get the Medicare Part D Prescription Drug Act. Have our prescription drug costs gone down since 2003? I didn't think so, because the same year, remember how I told you that the hospital supply groups got the right to receive legalized kickbacks?
Yes.
Same year as Part D Medicare passes, HHS quietly pushes in the right for pharmacy benefit managers, PBMs, to get legalized kickbacks. And by the way, I think at that point, Blue Cross Blue Shield already owned their own in-house PBM, Prime Therapeutics. And now if you fast forward a little, so Tommy Thompson left, and now he's on the board of an insurance company with Dick Gephardt, Centene, and by the way, Centene is pushing back on the transparency for PBMs in Ohio. It's too much for this episode. We'll talk about it later. But anyway, so here you see, let's go back and just retrace really quickly, Hippocratic Oath, doctor, patient, hospitals forming, good thing, charitable in the 20s, the flu epidemic has just happened. And then now we move to, the time right around the war when we get insurance companies forming. No one had insurance back then. No one had it. Also, no one had sugar and flour, and I'll tell you why we're tying those things together now. It could be like germs, guns, and steel. Insurance, flour, sugar,
the
sugar to run
storm.
the slaves, right, exactly. So flour storm, they're obscuring everything. So then around that time, we had insurance companies forming. The wages get tied, Americans' wages get tied to insurance, and then they're not uncoupled. So now your job is tied to your insurance and you can't lose it. Then we fast forward in the 60s, Medicare, Medicaid, people are paying for it. The government is controlling it. Income, our little friends from healthcare, many physicians, sadly, I'm sorry, many physicians that are not good people back in the day in the 60s, all the old guard that was doing this, have made monkeys out of us new guys. And then, we fast forward, we get the HMO Act, we get the old guard comes together, they form with the hospitals who have now become, more powerful because they're not exactly charitable these days. But that's another story.
They're
And then
suing
we get,
everyone.
yep. And then we get like carve outs. We get carve outs of kickbacks for the companies that are controlling hospital supply and pharmaceuticals at the very same time that physicians are getting the carve outs of like, there's no way you can have any kickback. We're going to prevent you from doing everything. Really, if you want to think about it, what they've done is they've taken that patient physician relationship that comes from here, and they've now conscripted American physicians. So we're in the control, right? And then some of us are even playing with that kind of stuff. And so we move forward 87, 2003, then we get to 2010. And, look, I know it's called the Affordable Care Act. And I think President Obama carried himself in a wonderful way. He seems to be a family man. He seems to be incredibly bright, a wonderful speaker. I love how he comported himself, but we haven't gotten affordable health care. And pretty much the hospitals, the PBMs, the insurance companies, and big pharma have all gotten richer, bigger. And now we're getting into the realm of consolidation. And everyone is hiding their prices because you can't see them. And just today, the Biden administration wants to reverse a rule. So for Medicare Advantage plans in hospitals, they don't have to publish their prices like the previous administration laid down in a rule, which was one of the best things we could do. So now let's go back to your question. All those people who said the free market is terrible and it's failed. Well, what defines a free market? I would think it's defined by transparency of prices, transparency of quality, transparency of knowledge for what's going on. And like, so for people to know how it all works so that you have, the buyer beware, right? Like, how can the buyer beware if he doesn't even know that with insurance and pharmacy benefits and hospital benefits and hospital purchasing organizations, how can the buyer beware when the buyer's like pretty much addicted to insurance, just like he's addicted to flour and sugar, and the insurance is now getting fed by the pharmacy benefits that are behind it, and the insurance is working together with the hospitals, and pharma's kind of on the outskirts with everyone, and they're all getting into bed with the government. Because here's another great thing that it may be hard to see, but you can look it up. I love the group. Do you know the group Open Secrets?
Yes.
I don't know if this will come through, but if you look on this is the top lobby groups over the last 20 years. I'll hold it up as I'm talking. And like you can see on here, who do we got here? Well, we got Blue Cross Blue Shield, remember, the old guys. And we've got the AMA. And we've got the American Hospital Association. Remember, we thought those hospitals were like such good guys. And we've got pharma, right? The big pharmaceutical companies. And we've got the AARP, who incidentally is selling United's Medicare Advantage plans, right? So like actually more than twice as much of their money comes from that as it comes from membership fees, because are they really in it for their members? No. And then if you want to look down this side, it talks about all those middlemen that we'll talk about later, because those middlemen, they're pretty much connected to everybody. So we don't have a free market. What we've got is frank cronyism here. And it's all in bed with the government, and they're all in bed with each other. And like, what I want to say and what I want to know, and maybe we can even end it with this. What's so funny about peace, love, and understanding? And if we want to wind ourselves out of this, we better have some understanding. We better get back to the idea of that bond. We better get some physicians who got that idea about, the love that they have for their profession and their patients. And we're not going to have peace with healthcare, and we're not going to have affordability until we understand it a little better, are we?
No. You've also founded or co-founded the Practicing Physicians of America. So maybe a thumbnail about that. and then finally we're going to do more shows and take apart some of these aspects of care. But the PPA, what is that about, and what are you doing with it?
Sure. So Practicing Physicians of America, I co-founded with Dr. Westby Fisher, a cardiologist in the Chicago area, in 2017. You know, just when I told you we had to study history, I sort of looked at history, and it seems to me that many organizations at the national level that either formed politically on the right or politically on the left. And then they just get mad at each other and they shout at each other. I mean,
Yeah,
it's terrible. I mean, it's the same
sure.
thing that Americans do over, so even physician organizations, and some organizations just became more right leaning or more left leaning. And then
Food fights. Hello.
that's not helpful either, because by the way, this list here that I gave you, these
Mm-hmm.
groups, I know probably everyone who's listening, the people on the right are probably thinking, my goodness, they're probably paying the left, and then the left are thinking they're probably paying the right. Forget it, they're paying everyone. They're hedging their bets, and
Yeah.
they're laughing all the way to the bank. So I started PPA, Dr. Westby Fisher, myself. Brian Jamal Dixon is a child psychiatrist in Texas. Naran Al-Ajba is a Naran Al-Ajba. I always say it wrong. She always says like Naran. Naran Al-Ajba is a pediatrician from Washington, on the coastal area. And Dr. Judith Thompson is a surgeon, a general surgeon in Texas. We're nonpartisan. We all got peace, love, and understanding. Like, we cross the aisle, but like, we all agree with each other that we need transparency. We need to wean America off of this idea that we're letting these people in the middle, these like greedy middlemen, and that includes insurance, that includes the benefit managers in the pharmaceutical world and the hospital supply world. These greedy middlemen are like, they've got us addicted to them because we're so scared of high prices. However, the prices don't really have to be so high, but we don't figure that out until we get transparency. And that all needs to happen. So we started PPA for that reason, practicingphysiciansofamerica.org. None of us take a salary for it. Our idea is let's make it so that physicians can practice as we were trained. So what obstructive forces can we get out of the way? Well, I've got a lot of obstructive forces to get out of the way. And it's hard to fight them.
Yes,
So,
there's a lot of momentum there and a lot of cronyism,
yes.
as you say.
So what I want to say too is that it's a physician organization, but we are tied through the Free to Care organization, free, the number 2, and care. Free to Care is about 30 member groups that come from patient and physician advocacy organizations. So the work that we do on price transparency and uncovering the costs of healthcare is really tied up, with Free to Care, and other organizations that are physician organizations are helping. And so as we get later on into the shows, like hopefully what we'll do is we'll talk about ways that patients and physicians can get involved, because you can. I mean, look, come on. I'm doing this in my bathrobe. I'm writing in my bathrobe. I'm talking in my bathrobe. I'm making up these ridiculous little charts with Sharpie pens from my desk in my bathrobe, and like, my little monkey talisman, like sitting around. And if that's all going on, then, you can do it too. It's like,
Yeah.
because good medical care belongs to all of us, and we need it to be of quality. We need it to be transparent in its pricing. We need to get it at the lowest dollar value. We got to knock these people out. And it is we the people, right? We the people. So let's get with it. We got to get the understanding, and then we'll get to the peace and love, right?
Yes.
Did you get the Elvis Costello part?
Yeah, I got that.
So funny about peace, love, and understanding. Anyway, go ahead. Sorry.
Dr. Mass, thank you so much. And I'm looking forward to our next conversation.
I am really looking forward to it, Hunter. We're going to have a great time.
Yes. And feel free to, come back in your duck robe.
I think it should just be the trademark. Do you want to hear the story behind it?
Sure, why not?
Yeah. So while you're here. So this happened, let me see, the oldest is a senior in college. So he was in He was in ninth grade at the time. So this is 7 years ago. So it was 9 degrees. It was a January day. And my kids come running in from the bus stop, and I'm wearing my robe and slippers. And the kids say, "You've got to drive us to school. It's cold out there. We can't wait anymore. We don't want to be late." I'm like, "Okay, let me go get changed." So they're like, "No, no, you must drive us now." So I'm like, I rushed out into the car. I grab my keys. I get into the car. I drive them to school. I'm like, "Oh my gosh, the gas tank, it's almost empty." And then I'm like, I drive to Wawa. We live near, that's our convenience store, right? So I drive to Wawa. I'm just praying that I'll make it to Wawa in time. I pull up at Wawa at the gas pump, and I'm like, uh-oh, my purse is not in my car. My husband has taken my purse out of my car because it had my checkbook in it, and he needed to write some checks. But my purse also contains my cell phone. So that's not cool, because I don't have my cell phone. I don't have my wallet. I can't pay for my gas. And so I had to get out of my car in my bathrobe in 9 degrees, walk into Wawa. No one flinched even. It was like people walk around there forever in the bathrobe, like no one even flinched. The girl behind the desk was just wonderful. I actually took her chocolates afterwards to thank her. I got dressed and did that. But I call up my husband. I said, "You have my purse. I need gas. I'm at Wawa." So he gasped, and then he comes driving up, and the long and short of the story is he came driving up in his bathrobe and pumped my gas in his bathrobe. So I sort of decided, you know what? And he's a surgeon, so if 2 doctors can meet at Wawa and pump gas in their bathrobe, then surely I can tell America what's wrong with healthcare in my bathrobe.
And there you are.